The reputation of CESAC enabled us to have so many so many famous speakers and awardees in the past. I'm not going to read all their names, but what I list here is just a tiny subset of many prestigious guests, including our today's speakers. Since July the 1st, I stepped down from the CESAC president position. Our new president is Dr. Charlie Lu. For all the new initiatives with CESAC, please contact Charlie. I will continue to serve CESAC as the chairman of the board. Okay. Due to unprecedented situation of COVID-19, however, I will continue to lead the team to complete our 58th CESAC annual convention, our first ever online event. Our event theme this year is Science Meets Art, and we will bring up two main topics, the future of Hollywood and space travel. We are trying to create some really special experiences for our online audience, and the event is expected to be in later half of August. If you'd like to contribute, please feel free to reach to me. With that, I'd like to bring out our today's host, Professor Xudong Jia. Dr. Jia was a professor and department chair in Cal Poly Pomona. Starting from July the 1st, he becomes Associate Dean, College of Engineering and Computer Science at California State University, Northridge. Also, as a Charlton alumni myself, I'm very proud to mention especially that Professor Zhang received Outstanding Achievement Award from Charlton University Alumni Association before. And he is now a board director of CESAC and is chairing the CESAC Technical Symposium program. Now, let me hand over to Professor Zhang. Okay, so Professor Zhang, let me stop sharing.
Let me get in first, just 1 second. Yeah, I'm in already. Thank you, Zuo-Feng. Good afternoon, everyone. I'm so honored to be the moderator of this technical symposium. You know, what's our topic? You can see it's about COVID-19 pandemic, right? There have been so many seminars since the start of the pandemic. And what's our differences? You know, all of the seminars we did before are from different perspectives. So let me give you our perspective in terms of our symposium. We have 3 highlights. First, we have 2 distinguished speakers, Mr. Danny Wu, and also, how do I say, Mr. Dr. Zuo-Feng Zhang. They will help us be familiar with the COVID-19 pandemic through their presentations. Second, we have a panel discussion. The panel discussion will be the one with this kind of a process. The audience will give us questions. 3 of the panelists, Danny, Dr. Zhang, and myself will be the panelists answering all of the questions you have. The last part, which is very important to us, is Zoom-based trivia competitions. So that means we have questions to be given to you, and the first person who answered the question correct will be given $20 gift card. So we will ask you to be actively, engaged in our process. So this is a symposium with 1.5 hours. It's a full of a program. So we would like to introduce, I would like to introduce the first speaker, Danny Wu. Let me introduce Danny somehow so that you can understand what's his background. Danny is the Executive Director of Transportation and Planning from Cal Poly Pomona. He oversees mobility and the transportation efforts at Cal Poly Pomona, providing strategic leadership in mobility planning and policy development, while managing a comprehensive transportation demand management plan for the university. Mr. Danny, I call it Mr. Wu, is a transportation leader and a practitioner with more than 25 years of experience in local, county, and regional transportation planning throughout California, Southern California especially. He has served as a senior director within the Los Angeles County Transportation Authority, transit agency manager with the City of Anaheim, program manager with SCAC, Southern California Association of Governments, and also as assist vice president principal consultant with the WSP USA. So he has so many titles. We know him based on his dynamic thinking, leadership, innovation, proactive management style, everything. So he has so many titles. We are so glad to have him here today for us. His topic today is pandemic impact on people's travel, traffic trends, impacts, and also resources. His presentation is about 25 minutes. So let us welcome Mr. Danny Wu for his presentation.
Thank you, Dr. Zhang. Can you all see my presentation?
Yes, we can.
Okay. All right. Well, it's certainly a pleasure to be on today's panel. This distinguished panel is such an honor for me to be working with Dr. Zhang again, who used to be with Cal Poly, and I've known him for a few years. Also wanted to thank my colleague here on the panel, Dr. Zhang, for his excellent work in the public health field at UCLA. So thank you for all your important work that you're doing with the public health industry. So as Dr. Zhang mentioned, my topic today is focused on the impacts that COVID-19 has had on travel, particularly personal travel and transportation within the within California. And this is a especially interesting topic to me because there's been such change in our industry over the last few months. And it's such an exciting time because there's been an enormous amount of data and analytics that have been presented and analyzed to look at how the COVID-19 has affected people's travel behaviors and decision-making process, and also how it's affected use of public transit. It's also exciting to see as a practitioner and a researcher, the types of innovative applications and recovery methods that agencies are taking to try to make our system safer for the return of people back to a sense of normalcy. So before I get into my presentation, I do want to give a little bit of background on Cal Poly Pomona. It is one of two polytechnic universities, part of the Cal State University system. We have 54 undergraduate and 28 graduate programs and one doctorate program. 38% are STEM majors. Our enrollment is about 28,000 based on last fall's enrollment numbers. And we're a highly ranked university, particularly our College of Engineering and our urban and regional planning programs. Much of that thanks to folks like Dr. Zhang and his years of tremendous work at Cal Poly to really elevate the College of Engineering program for our university. So thank you again, Dr. Zhang. So the question that we all have is, what are COVID-19's long-term impacts to travel? The picture on the left, shows what used to be normal before the shutdown, crowded public transit systems across the world. Here's a picture of the New York subway system. And the picture on the right is, how people are viewing public transit today. Is it safe to take transit, and how do we maintain social distance? And now agencies are struggling to make sure that there's enough space and distance on their buses and trains. Researchers are also looking at the effects on mobility overall. You know, are people taking other forms of transportation like bicycling? Are they walking more? And how has that disrupted city life? You know, how has that also affected accidents and death rates on our roads when there's fewer travel on our freeways and streets? On the topic of deaths, you know, here's an interesting chart that shows just the amount of deaths, the average deaths per day that COVID-19 has resulted compared to all the other natural causes of death. And you can see it's quickly risen to the, you know, the top ranked causes of death, even above cancer and heart disease. So these are quite alarming statistics. For those of us that are working in the traffic field, we often cite numbers of 35 to 38,000 annual traffic fatalities that occur in the US. So compared to the deaths that we see today with COVID, 130,000, we're seeing, again, a tremendous amount of deaths, to put that into perspective. Again, my topic for today is focused on transportation. And transportation is one of the 16 sectors that the federal government had identified as a critical and essential sector that needed to remain open during the shutdown period. And so my topic today will not only focus on the travel impacts, but also what the fiscal concerns have been. How has that affected gas taxes and revenue sources for transportation? How has COVID also impacted safety on our roadways, and how it's also improved our air quality system? And then more importantly, how has public agencies and different agencies across the country responded to the COVID situation, put in recovery plans, and created innovations in our industry? So I'm not going to go into this. You know, this is kind of a quick chronology of the events that happened that led to the shutdown in early to mid March. And here's a graph that shows the 7-day average in terms of personal travel. You can see travel significantly decreased in the mid-March timeframe and gradually started to climb again in the mid to late April timeframe. And so now we're in a situation where the different public health agencies in the county and the state have begun to implement their phased openings. We're also starting to see travel starting to plateau a bit in the late June, July timeframe. This graph shows the weekly travel trends. You can see by day of week how that has changed between March through June. And here's a chart that shows the trends across 4 of the leading states that right now have hotspots of the resurgence in the COVID. So again, all 4 states show a significant dip in travel in late March, and then quickly starting to rise as phased reopening starting to happen. And then you can see dips again in the July timeframe. This is a chart that actually is based off of data from Apple. It's based on their usage of big data and how people use their mapping system. And it shows a similar trend. The 3 lines represent, driving, walking, and transit. So again, with the reopenings, people are starting to drive more and walk more. But as you can see at the lower graph, transit usage still remains quite low. There's a graph that shows just the change in traffic volumes. for the nation as a whole on the upper left quadrant, and then 3 major cities in the US, Seattle, San Francisco, and New York. And you can see the percentage decline in traffic volumes by day of week from mid-March to late March timeframe. You can see it's been quite significant, upwards to about 51% decline in traffic. And similarly, this is a chart or data from the US Bureau of Transportation Statistics, and is measuring trips per day. So we're looking at the chart on the left, chart on the left is of the entire state of California, and the chart on the right is just for Los Angeles County. So similar trend line. Again, some data from Apple, which shows comparison of travel trends between countries. So the chart on the left compares Italy, Germany, United States, and United Kingdom. The gray line represents the United States, and it's showing that travel has now picked up in the late June to July timeframe. It is now 17% above the baseline numbers. And then chart on the right is just for Los Angeles. And it's showing walking, driving, and transit. Again, transit is still far below the baseline conditions. Like I mentioned, there's a lot of interesting research by academics across the country. Here in California, researchers at UC Davis did their own analysis of looking at the impacts on travel in the state. And here's a more micro analysis looking at how traffic volumes have declined for specific freeway corridors. So you could see between the March and April timeframe how volumes have declined pretty much on all major US highways. Again, I mentioned that big data has shown it's become an invaluable data source. So Streetlight is a major vendor that aggregates GPS location-based data, and they put together a dashboard site that produces vehicle miles traveled for the entire nation. And this 2 charts here show the VMT, vehicles miles traveled, for the Southern California counties, comparing the March timeframe and on the left, and the July timeframe on the right. So you could see in the late March timeframe, VMT had declined by 75%. And then here in early July, VMT has gone up again, and it's now still below normal conditions, but by 31%. So besides general purpose traffic and how that's declined, I also wanted to show a graph on how toll lanes, express lanes have been impacted. And this was a presentation that staff at LA Metro presented to the Transportation Research Board, and it's looking at how COVID-19 had impacted the toll transactions and toll revenue for express lanes in Los Angeles County. So as you can see, there's also been significant decline in its usage. Transactions have declined by 60 to 70%, and toll revenues have declined between 80 and 90%. So quite significant for that agency. So on the issue of funding, with the decline in travel, that's also had a significant impact on gas tax revenues, which is a major source of revenue for the state of California. Some estimates have identified about a 75% decline in sales tax, gasoline sales tax revenue. The state's fuel tax revenue dropped from $61 million in early March to about $15 million in the second week of April. So quite significant. And besides gas tax, the estimated gap in funding for LA Metro alone was $1.8 billion. And that's if you take into account sales tax revenue, fare box revenue, and toll revenue, which are their major sources of revenue for its agency. So again, quite significant, and such revenue impact will have long-term impacts. Here's a chart of research that was done by the Moneta Transportation Institute with San Jose State University. And researchers there tried to model different recoveries, economic recoveries, and how that might impact the future projections of gas tax revenue. The black line represents the baseline. Before COVID, there was already estimates that gas tax revenues would be declining, mainly because of greater fuel efficiencies with our automobiles in our fleet. But there are different policy strategies that can help recover some of that revenue, whether it be increased fees to purchase or incentivize zero-emission vehicle purchases, or other policy alternatives. And this graph here shows a range of potential gas tax revenue projections. So if we have a slow recovery, researchers have predicted that by 2030, the total annual revenue would be about $9.4 billion. But on the high end, with aggressive and quick recovery and aggressive policies to stimulate zero-emission vehicle purchases, that could translate to an increase in gas tax revenues amounting to about $11.5 billion. In terms of traffic speeds, this chart shows how peak speeds have changed in not only the peak speeds, but also the average speeds across multiple highways. And with speeds, that obviously impacts the safety, fatalities, and injuries on our freeway and roadway system. So here are these two charts based on California Highway Patrol incident data that's collected. These show the amount of decline in traffic crashes and fatalities since March through May. In the middle of both charts, you see actually an increase in the early April timeframe. And that was mainly because of the late rain that had occurred on like a few days during that month. So there was actually an increase in crashes and fatalities, but overall significant declines in terms of crashes and fatalities. Here's just another chart showing the reduction in accidents and injuries by county. So it compares March 2019 crashes in the red bar compared to the orange bar, which is March 2020 crashes. So again, significant declines in highway-related accidents and injuries. The good news is the shutdowns have also significantly improved air quality. And for Southern California, that's significant because we live in a non-attainment area. And this chart shows the reduction in NOx emissions for the Los Angeles basin. Similarly, researchers have also estimated significant reductions in greenhouse gas emissions for the entire nation. So you can see here across the country, just about every state saw significant declines in GHG. The US having sufficient GHG reductions over an 8-week period to exceed our target reductions under the Paris Climate Accord. So that's pretty significant in itself. Here is how GHGs have actually reduced in California. So estimates are upwards to about a 75% reduction in our state alone. So what's been the impact on public transit? Obviously that's been quite significant. These lines represent multiple transit lines across the US. And you can see, just like the traffic volumes, ridership and public transit usage has significantly declined since the closures. And they're slowly starting to recover, but not as fast as use of automobile. Here's some data from the Bureau of Transportation Statistics looking at the ridership impacts for 3 major transit systems: BART in the Bay Area, WMATA for the Washington metropolitan area, and the Massachusetts Bay Transportation Authority. So you could see ridership has declined, between 80 to 90%, pretty significant. So the question that people often have is, who was actually using public transit during the shutdown? And this was a survey that was done by a company called Transit App of transit users across the country. And you can see that the majority of users were female riders, about 56% compared to 40% male. In terms of race and ethnicity, the majority of people surveyed that continued to ride were African American and Hispanics. And what were people taking public transit for? So, and what type of industries did they work in? The majority were people who were involved in healthcare and food services and some sales. The good news is the federal government recognized the importance of public transit. So Congress had passed the CARES Act, an unprecedented amount of funding provided to the public transit industry, about $25 billion. And about $1 billion of it was apportioned to Los Angeles County alone. And this is how that $1 billion was being allocated to transit agencies across our county. The majority of it going to bus operations, municipal bus operators, as well as LA Metro's own bus and rail operations. So how have public transit agencies actually responded to COVID? So the majority of riders, agencies have actually instituted a rear door boarding only operations, and they've added protective barriers for their bus drivers. And a great majority implemented extra cleaning of their buses and trains. The majority of the transit agencies had to decrease services because of the decline in ridership. Some canceled routes, but many also started to implement weekend scheduled type service. Here locally, Metrolink, which is the commuter rail system, they did their own survey to see how their riders would respond and how likely they would come back to riding their system. And in their survey, 81% actually said that they would ride the Metrolink system again once they felt the system was safe. 71% actually described themselves as essential workers. So a great majority of public health folks and people that were identified in the 16 sectors are riders of the Metrolink system. And riders also expressed interest in returning, but under certain conditions that ensured their safety. So here's an interesting research that was done by Vanderbilt University, and it looked at what would happen if transit users didn't return to transit and they shifted modes to taking the automobile. And so they looked at different scenarios. And for major metropolitan areas across the country, they estimated that if 1 in 4 transit users shifted their use to automobile, then you could see a significant increase in their travel times, upwards to 10 to 20 minutes of travel. So that will have a significant impact if people continue to fear taking public transit. So this is just a vignette of different communication strategies that different transit operators have implemented across the country. They're aggressively trying to communicate that transit systems are safe, that they're implementing safety protocols, daily cleansing of their bus systems, and trying to stay consistent with the messaging of public health authorities. Metrolink also created this interesting tool which allows riders to plan their trip in advance so they can see how full the trains are in order to allow them to feel safer in taking the system. So if you don't feel safe when the train is overly crowded, you can actually look up to see the percentage of riders taking a particular train. So I thought that was quite interesting. Here's just a sample of innovations that public transit agencies have implemented. The Jacksonville Transportation Authority on the upper left, that's a photo of a autonomous shuttle system. That transit authority partnered with the Mayo Clinic to actually deliver pharmaceutical devices to the hospital using their shuttles. The picture on the upper right is a picture of a Sacramento transit bus offering the community free Wi-Fi services for low-income and disadvantaged communities that don't have internet service. We're also seeing a significant increase in bicycling and walking. A lot of cities across the country and the world have started to institute open streets to encourage more walking and bicycling. So that's also a positive change. And we're also starting to see more creative uses of the significant amount of vacant parking lots that we have across the nation. The picture on the bottom right is of the Pasadena Rose Bowl, where they recently started to implement drive-in movie theaters again. So some innovations are starting to happen. So again, that sums up my presentation. Thank you, everyone.
Good. Thanks, Danny, for giving us such a wonderful and insightful presentation. We have learned a lot about the impact of COVID-19 on people's travel. Thank you so much. Now is the kind of time for us to have a poll-set questions available. I'm so glad to see a lot of people attending our symposium. Right now, we have 115 audience people down there, waiting for the thing. Now is 116. The highest is 120. Now I would like to go with the first poll question. Terry, can you present it out? You can see which impact of a COVID-19 pandemic are you most concerned with? You can choose more than one options if you want. The first one is the impact could be potential loss of job, furlough, or difficulty in finding a job. Second one is challenge on people's domestic and international travel, challenge on physically going back to school, or ICE deportation order. Which one is the one you feel most concerned, within the pandemic, kind of a period of the time? I'm so glad to see a lot of response from our audience. This is kind of nice to see the interactive way of getting your knowledge, your concerns to be explored, to the audience we have here. I mean, it's very important to understand what's going on. I can tell, I'm not sure we are ending the polling or not. Terry, can you tell us?
Yes, we can end the polling now, or maybe we can give everyone another 15 seconds, and then
Okay.
end the polling and share the results with everyone.
Okay, good. So let's do 2 minutes, see how it goes.
Sure, they give us another 30 seconds.
Yeah. So now it's 1:32, 33. So we will see which one is the one competing with the others. I'm wondering the question. So clearly this is the one different group with a different kind of result, right? I'm just wondering within our 117 people, what's our preferences, what's our most concerned in terms of impact caused by COVID-19.
Okay, I'll end the polling now.
Okay, good. I can see challenging on people's travel, domestic and international. That's the first one concerning us. So I'm glad to see that. Now we have another fun part we need to do. This time is the one we need to have the first trivia question. As we said, the first person who answered the question right will be the one to receive $20 gift card. I ask everybody to be ready. So are you ready now? So we have 120 people waiting for the first question. I ask Terry to, just 1 second, to present it in a minute, the question. Everybody ready? Okay, Terry, present the first question.
It is presented.
Can you tell us who will be the first one answering the question right? Oh, by the way, board members of a CESASC are not allowed. They are not eligible. So people from outside is the one we would like to see the result of it.
Please type your answer. We do have one.
You got one?
Yeah, we got one.
Okay, so you want to show the answer to the audience?
Sure. So CESASC stands for Chinese American Engineers and Scientists Association of Southern California. So
Great.
we got Zhang as the winner of this game. I'll contact you in a short bit and to get your contact information and deliver your Amazon gift card.
Right, this is good. So we got the first trivia questions offered with the answer correct. And I believe you have a good time. I believe that the person who received the prize will be the one.
The answer is not right from Zhang, right?
Is it?
He missed.
Oh, he missed the Chinese American.
He missed the Chinese American, which is important thing. So we need to pick up some later answer.
I think Jason is the one that's closest. He misspelled Chinese.
But it's fine. Maybe that's okay. I will.
But I think that's the first one that actually do refer to Chinese American.
Yeah.
So
sorry,
you decided to go which one's the one for the winner?
Jason Wang.
Okay, good. Jason, I believe you have a good time with us, right? Good. So you can buy PPE stuff. You can do whatever you want to do with your gift card. The gift card will be given to you later.
And for those who didn't win, we still have more.
Yeah. Oh, sorry, Jason. I ping you. I give you the gift card right now. Okay. Thank you.
And for those who haven't won, we still have 2 more questions waiting. So just stay tuned.
Yeah, given the first trivia questions over, let's us to introduce our second speaker, Dr. Zhang. Dr. Zhang is a well-known professor and also Associate Dean for Research for the UCLA School of Public Health. He is also a co-director of the UCLA Alper Center for Environment, Genomics, and the director of Cancer Molecule Epidemiology Training Program. Dr. Zhang has been a fellow of the American College of Epidemiology and members of the board of directors of the American College of Epidemiology. The most important part, he was a World Health Organization, WHO, consultant for national non-communicable disease prevention and controls in China. This is a kind of good title for us to know. With this kind of experience he has, he will give us a presentation related to COVID-19 pandemic, current status, and the future trends. His presentation will be also 25 minutes roughly. Now let us welcome Dr. Zhang for his wonderful presentation now.
Thank you very much, Dr. Jia, and thank you very much for President Lu for the invitation to give a presentation for the CESASC. And it's the first time I'm the one outside of your, your major, but I will talk about, the epidemic, the pandemic, what happens about COVID-19 in the whole world as well as in California. So as we probably know, you can see my first slides, which is in the whole world, we have 12 million new cases of COVID-19 and 550,000 deaths in the world. United States accounts for about 25%. We have 3.2 million patients and 135 deaths. So what happens in California, which is California accounts for 9% of the United States, about 300,000 patients and 6,000 deaths. So basically that's where we stand on this pandemic. So this table actually presents the top 10 the states of COVID-19 based on the numbers of patients. So New York State definitely number one, but California is number two with 300,000 patients. Then we have Texas, Florida, New Jersey, Illinois. We have top 10 states here. And so the numbers are quite high in each of the states. However, we have to think about the population in the states. So it looks like California is the second one, but if you look at the real numbers, considering the population size would be different. So where do we stand? The California stands at number 2 in terms of patients, number 6 in terms of the deaths from the COVID-19. However, if you use the incidence rate, considering 39.5 million population in California, we ranked 26 in terms of incidence of COVID-19, and number 30 in terms of mortality of the COVID-19. And in addition, we ranked 16 states who actually performed more tests than the rest of the states. So here are where we are. So I'd like to mention one thing, which is in the fourth column, which is we call the case fatality. So if you look at, that means somebody who has a disease but died of the disease, the proportion of people died of the disease when they've been diagnosed. So if you look at all over the world, it's about 4.5%. That means 100 patients with the disease, 4.5 people die, right? In the United States, we're a little bit lower. We have 4.22%. In California, we're quite low. We're about half of the United States. We have 2.26%. So I think we're doing quite good. And in addition, if you look at detection rates, in the U.S., I think the overall is about 8% of people who had a test but positive. But in California, we only have like 5.5%. So if you look at New York City, New Jersey, they all around 10%. So we're quite low in terms of the COVID-19, the testing positive patients. So here are what happens. I think everybody are kind of start to worry about this pandemic in the United States. So in the first 1 million, patients took us 99 days. The second million cases took us 43 days. But right now, the third million, when we reach the third million, we have 3 million, more than 3 million now, took us 4 weeks. So that actually indicates quite rapid in terms of the increase the numbers of the patients in the United States. So that actually, we probably need to ask what happens in the United States. Why, for most of the states, we have the in-house, the recreation, and we stayed in-house for 3 months. And what happens? Why the patients still increase? And also this increase, not only if you look at the states, we have 38 states which increase, including California, including Florida, including the Texas, Arizona, and including a lot of other states. So clearly are increasing. So what's the reason of the increasing of the COVID-19, especially among the 38 states? I think the most important reason is reopening of the economic as well as the society. So with the opening of restaurants, the bars, the beach, and so that actually made people's distance becomes much more smaller. The second thing is that the protest. I think right now, if you see nobody would like to say the protest actually is lead to this increase. In fact, if you look at the situation, the protest starts end of May, and which is really increased this pandemic in the United States because people's distance becomes much closer, and also less people use the face mask, and a lot of things happen there. So that's the second reason. The third reason is that people become more relaxed. They're not as nervous as the early beginning, because at the early beginning, people are very kind of scared of this disease. But right now, when people see there's some treatments and not everybody who get the disease be hospitalized, not everybody get into ICU, the mortality rate are not as high as the people predicted. So I think people start to be relaxed. I think those are 3 major reasons, and especially for young people, they start to have parties, they get together, and so you get infected at a young age. Yes, you might not have a high chance to get into the hospital. However, when you're going back to the home, you're going to start to infect your parents, your grandparents. That actually causes a major problem. So good news is that still we have kind of 16 states are very stable. Those 16 states, including the states with very heavy hit by the COVID, including New York State, New Jersey, Massachusetts, Rhode Island, Connecticut, Pennsylvania, and other states. So those states, you see, they had the same exposure, which is the demonstrations, the protests. They also had the same issue of the reopening of the society. people get much more relaxed. However, why other states, other 38 states, they are increasing, but those 16 states still stable? That is an indication. The first thing I think is that because their infection rates are quite high, which is around 10%. California is about 6%. So we're not as high as New York City or New Jersey. New Jersey is about 11%. The secondary, people start to keep not that relaxed because a lot of people died of this disease. They still keep the social distance. They still wear face masks. They still kind of keep the personal hygiene. That is why, that's why this actually gave us the confidence. This disease could be controlled. And you look at, this is a good example of the 16 states. That's what happens, why in the US with the same exposure, same thing happens, but why other states don't have that kind of increase. So that is good news to us. So another good news is that you see this on the top is increase the incidence rate of the COVID-19 in the United States. They kept increasing. However, the reported deaths per day kept dropping. So that means less people dying of this disease. There's a major reason of that. First, we have sufficient beds. Secondly, we have enough, the ICUs. The thirdly, the doctors had sufficient experience now, not like very beginning, the people come in, they don't know what to do. And fourth, there are some effective treatments on this disease. So that's a good thing. The death is a major measure about how severe this pandemic is, right? So look like, we had a tremendous problem with over 3.2 million new patients of COVID-19, but the deaths per day start to dropping. So that's another thing we need to pay attention. So this is from CDC. And you can see on the top, the red curve is people over 85 years old. They're very much aging people. The second is 75 to 84. The third blue one is 65 to 74. So you can see the death rates on every age group are dropping. Right now, it's start to be very, very low. So that indicates, not like people predicted earlier times that, in the United States, they might have 250,000 deaths if at the end of this pandemic. I see right now with the numbers of very much deaths slowed down, we may never get to this number if we keep very effective preventive measures. So here is the comparison by age group. So most of the age group, the aging people died has a very high mortality, but young people, you see that if the age under 45 is 1.5 per 100,000, so very, very low. Even including the age 45 to 54 is 13.2 per 100,000. So if we look at those numbers, so the mortality, if younger than 65 or younger than 55, your chance of death is quite low. So this is a curve in California. So the top one is the incidence rate. You see the incidence rate in California increased sharply, especially from the beginning of the June. It's kind of increased a lot. But the death rate is very stable because we start with much less numbers deaths per day. So right now is quite stable. So that's also a good thing for the California because we have right now we have sufficient beds, hospital beds, and we have the ICUs. We still have some space for ICUs. If we have beds, if we have ICUs, that indicates that all of the severe patients can get good treatment, so the death rate will not be increasing with the incidence rate. So here this curve gives you some numbers, which is the blue one is in 4 weeks the increase of the numbers of the patient. For example, in the United States, is the 50% of increase. In the California, is over 100%, doubled in last 4 weeks, and in Los Angeles is about 90% of increase. So those patient increase. However, the orange one and the gray one, orange one is a hospital rate, the people being hospitalized. So you can see this becomes much lower. And the third one is the death, proportion of deaths, also much lower. So I think we're doing okay, the California, United States, and Los Angeles. Sorry. So I think I'm going to. So next session is about what is the difference between different racial groups. And of course, the Black American has a very high mortality rate. Then the Native Americans, then Hispanic. The Asians and the Caucasians are quite low. If you look at this curve, we all increase, but the Black Americans actually has a huge increase in terms compared with other groups. And this is an incidence rate, especially for age-adjusted. The Asian is slightly higher than Caucasians, but still we are quite lower in terms of the death rates of COVID-19. And this is an interesting curve I presented in the last meeting, and I updated yesterday. So you can see this curve is Asian countries compared with Caucasian, the Western countries. All of the higher bar are Caucasian countries. You can see the first one is Belgium, the second one is Spain, third one is Italy, fourth one is the UK, sixth one is the fifth one is the France. Then so you can see that the United States is the ninth one, which is the 41.2 per 100,000. So those all high bars of Caucasian, if they're majority of Caucasians. But the lower portion are Asian countries. The highest is Iran. Then you have Turkey, Israel, Philippines, South Korea, Japan, Malaysia, Singapore, China. They're all extremely low. This is not, when people talk about China's data, say China's data may not be the true data, but if you look at other Asian countries, they all don't have a high mortality rate. So that actually gave us some question, we might have some questions about why those Asian countries has a relatively lower mortality compared with Western countries. And this is a quite interesting question. So I personally believe the first one is the face mask. Face mask is really effective preventive measures. If 100% of people wear face mask, this disease is going to stop. Why? Because when you wear face mask, you are not only protecting yourself, you also protect others. If you're the patient without the symptoms and you don't know you have a disease, if you wear that, you stop yourself to transmit to others. And also you protect yourself if you wear the face mask. I think this is Asian countries. You go to Japan, you go to Hong Kong, Taiwan, Singapore, South Korea. They all wear face masks. I think this is a very, very effective measures. I don't know why WHO, the World Health Organization, still does not promote face masks. I think they're very, very slow in this process. They're not leader. They just slowed the process. And second thing, people has guessed is because we have the Asians, most of Asian countries has a BCG vaccination, which is a vaccination for tuberculosis. And so the tuberculosis is a different disease, right? But tuberculosis is also lung disease, right? So they probably, this vaccination may also not only kind of strengthen your whole immune system, but also probably strengthen your lung to make your lung has a high resistance to the COVID-19. So this actually, there are a few clinical trials right now to trying to see if the BCG in fact can prevent the COVID-19. Third, I think Asian country probably has less comorbidities because the obesity is not is a major the comorbidity for the deaths. But Asians usually, most of Asians are not the overweight, obese are not very high. Not like the United States. United States, about 70% of people either overweight or obese. 35% of people are obese. So those people who are younger than 45 years old, if they got diagnosed with COVID-19, but if they also have obesity, then they have a high chance of the death. So that is something the Asian countries don't have. And other issues, probably the detection rate is a problem, and maybe underreporting. So those are also possible reasons. So let's start. I think I have 3.5 minutes to present. So I just go fast, a little bit fast. I think for vaccination. So right now, a lot of over 150 vaccines being developed, but right now the only one gets a limited approval, which is the China one, being approved for the military use. This one only passed the phase 2. So then we have 3 clinical trials in phase 3, which means as soon as pass end of this trial, and it's going to be can be used in the population. Then we have 11 in phase 2 and 14 in phase 1. And I'm not going to go over. So this is the one on the top right corner is the one being approved, limited approval developed by China. And the top one, left one, Moderna vaccination, I think is going to, right now it's in phase 2, and it's going to get into phase 3 very soon. It's beginning of the 2021, it's going to have vaccination. And I think some noise from Penny Wang. Then the one on the lower left portion are the vaccination developed by Oxford. That one is going to have, I think the first product is going to be in later September or October. They're going to produce over 2 billion doses. So this one also have a very high hope about vaccination. The last one on your right lower corner is the one, the BCG vaccination. So that is a try on that. So, okay, so the next is about potential treatments. So we know that we have some good medication past the clinical trials. One is, everybody knows in Chinese. Vicky's iPhone, yeah. So I think there's one we call the 人民的希望，这个是 can shorten the hospital stay from 15 days to 11 days. The second one is a Chinese drug. It's not Chinese. We know the medication, common medication called the 地塞米松. This one actually can cut the deaths to 1/3, and a lot of other medication being developed. So prediction, I'm not going to talk about prediction. You can see my slides. I just want to say, how do we prevent in the last minute? One is face mask. Everybody should wear face masks. Social distance is very important. Personal hygiene is important. The physical activity, high nutrition, and high quality of sleeping. And also people with with overweight should reduce your weight, hypertension should have tension control, and mental health is important. When you stay home for longer time, may have mental health issues. Trying to go outside, protect yourself, use a face mask to every day going outside. So I think I'm done with 25 minutes. Thank you very much.
Thanks, Dr. Zhang, for such excellent presentation. We learned a lot from you about COVID-19 in terms of a vaccine, in terms of prevention, in terms of the impact. I'm so glad to see, the death is going down day by day. This is a kind of nice way to see that. But no matter what, we have to be used to this contagious virus, no matter what, even before or after the vaccines to be developed. Next one we need to do, based on the time we have, we need to go through the second interaction with the audience. So we would like to have a poll also. I would like to ask Terry to present the second poll question. So far we have 125 people on the list. I hope we can get a list, 100 people participating in this kind of process. Which one, let me read this one for you. What will our fight with the COVID-19 be like in 10 years? The virus will disappear magically at some point. The virus became mild like flu. Herd immunity works. Vaccine works. Nothing worked. We will wear masks for next 10 years. So what do you think? Based on the knowledge you have, based on the presentation we got from our speaker, Dr. Zhang, so what do you think? So far, I got 52 people participating in. Hopefully we get more. We got 58. Let's hopefully we can meet like 80. 63. 66, 67. Wow, that's kind of a nice active participation from all of you, even though I don't know who you are, but I like your attitude. Your attitude shows your careness, your concern, your way of thinking of the life related to pandemic. Pandemic is a bad thing, but sometimes we get used to it, right? So that's one. Let's wait until, let's say we can meet our target, 80. So we have 8 more person to be involved. That would be good though. 8 more. Can we do 8 more? Okay, we give it up because of the time. So Terry, can you close out this one? Good. You can see from this poll, vaccine is our hope. Without vaccine, we cannot get the job done. Hopefully we can get, the first round of a vaccine to be perfect for us. And also we can get a majority of vaccines available internationally. Hopefully FHWO promote all of the vaccines for us. So we don't worry about this one anymore. So we're back to normal life. Now I would like to go to the next one. Can you close this poll? Yeah, let's go to the next one. The next one is related to, the trivia question we have. So the second one right now we have, if you answer the question right, the first one, you will get another $20. I wish I give another 5 to you. I would like you to be ready. So hold your hand. Make sure you can read, the slides in a minute. So you can make your finger fast and put your number in, your answer in quickly to where? To the chat box. Okay. Okay. On your mark, Terry, get set, show the question.
We got a real quick one.
Yeah.
Oh.
Jia was the first one to answer.
The person is a board member or not?
No.
Okay. So we got the second winner with the $20 you have. Question to the person, can we allow him to speak? What do you want to do with your $20? Can you say some, just one sentence or two, or chat on it?
Jia, do you want to unmute yourself?
Okay, thanks. Maybe buy a toy for my baby. Thanks for organizing this great event.
Thank you. Thank you for your active participation. You know, sometimes lucky things is just start from the beginning, right? So with the active participation. So we have a few minutes. I checked my time. We only have 15 minutes regarding the panel discussion. So we have 3 panelists. We have Dr. Zhang, Danny Wu, and myself to be the panelists to answer the questions you have. So just look at your question down there. You can send the question through the chat box. You can send the question by sending the information you want to the chat box. Terry Guo will look at it. Now he will present the question to us, 3 of us. Dr. Zhang and also Danny, are you available? Can you make yourself with the camera on and also make yourself unmute too?
I think they're on.
Okay, good. So 3 of our panelists are available right now. So let's get the first question out.
So I will start with the question that we collected before the meeting, because initially we have the Google form to collect the questions. One of the questions that we came across is that recently we saw ICE called for foreign students to leave if their schools are offering like online only classes. And we saw universities like Harvard and MIT sue the Department of Homeland Security and ICE to fight back. What do you think of this issue, and do you have any suggestions for the international students at this time?
Wow, this is a good question. It's kind of questions we need to answer from academic point of view. You know what? Let me ask Dr. Zhang to give quick response, and after that, Danny can give you a few ideas related to it. I will close out quickly too. So, Danny, Dr. Zhang first.
Yeah. First, students do not go back to home. Stay here. The secondary, those universities, including UC, will sue the government. As if we sue the government, they could not do it. The third, talk with your professors. They can offer, in-person class. They can create this chance to keep you here.
Danny?
Yeah, this was definitely an alarming development for our institution. Obviously, we're just as disappointed in the decision by the federal government. We're working closely with the state of California, the Cal State University system, as well as UCs to see how we can best address this. Our campus has asked students that are concerned about this to work with our Office of International Students and see how we can help address any personal outcomes of this and how we can help best deal with the situation. But definitely this is not something that we're supportive of.
Yeah, let me answer the question from my angle here. Actually, I was shocked when I heard the news regarding that, but I still believe this is kind of the one reflection of President Trump, his belief. He wants all of the schools to be open, right? He wants the schools from K to 12, all of them to be open so that parents can work. He also asked the university to do the same thing. Clearly, if we have all of the international students out, the US will lose about $45 billion. So this is quite a revenue, but I believe President Trump doesn't care about that much. I think he wants whole economic, power to be engine to be operated one more time. But given this case, no matter what do we need to do? So we look at it from 2 angles. One angle is from the student's point of view. As Dr. Zhang said, if you are here in US, don't go anywhere. Stay, trying to manage yourself. Second one, if you choose the classes, hopefully you choose the classes with a hybrid. I will talk about in a minute. Not all of the classes to be online, so several classes to be hybrid, so that you can say, you can claim yourself not truly online, so that helps a lot. The third one, if you are outside, away from US, you know, maybe someplace in Asia countries somehow, trying to pay attention to this, and also trying to get your classes in. Hopefully you can go to the visa office to get your visa as much as you can. If you get some denial, you can send your president some letter regarding that. From university point of view, right now, several universities, including CSU, California State University, we're trying to find a way to solve the problem. You know, UC, Stanford, MIT, they are working on the lawsuit, you know, legal action against the government, right? That will be taking a long time. I'm not sure they can handle that effectively, quickly enough. So the university right now think about offering the fall 2020 classes to be not online 100%, but hybrid class. If we consider that one to be hybrid class, that may be the case. Yesterday, I was asked by the CESASC president to handle the business. They want me to tell her how many foreign students we have within the College of Engineering and also computer science. We're trying to find solutions for all of the foreign students. So stay tuned, a lot of things coming in. So this is not the end of the game. So don't be panic. If you stay here, just stay here. So trying to be positive as much as you can. Second question you may have, Terry?
Yeah, so the second question we collected before the meeting was that we all know that different countries face different challenges. What is the challenging factor more specifically for the US to control the pandemic compared to the other countries?
I would like to ask Dr. Zhang to answer quickly. And he has a lot of experience, and he is also the HWA consultant. He may have a perspective, you know, from different angles. So, Dr. Zhang, can you give an answer?
Yeah, we have a lot of challenges in this country. Otherwise, our case will not increase like that. The first challenge is that the US CDC did not do a good job at the very beginning. And they just they think this is another flu, and go to end, it's not a flu at all. And they're not prepared. So they delayed the whole process for about 6 weeks, and which actually caused this, in the US, a big epidemic. The second challenge is the population. The US, you know, our population is very like to be freedom. I don't want to use a face mask, don't want to be at home, they want to go anywhere. And that actually made, you know, social distance becomes much more difficult. And also, you ask people to wear face mask becomes much more difficult. So I think with those, I think those are two angles about our challenge. If the population listens by November 1st, we are going to have 30 to 40,000 less deaths if everybody wear face mask. But I don't think that will happen.
Danny, do you have a few answers for that?
I think I would only add that the other challenge that we have in the U.S. is just the fragmentation in terms of governance. You know, we have, you know, the federal government not having a clear policy or plan of action from the beginning, and then on top of that, you know, each state having its own reaction and policies to how best to deal with the closures. And then on top of that, individual counties and local jurisdictions having different rules. And that's caused a lot of confusion for the, you know, basic populace.
I see. So my way of thinking on this one is the challenge is a face mask. I don't understand why face mask is kind of the political battleground. So people from blue states and also red states, they view the face mask different way. So this is kind of challenging to the US. You know, other countries, they consider face mask to be the one they have to require them to wear. So this is kind of the differences in my mind. No solutions, but this is kind of challenging in our mind.
Can I add one more point? So I saw a question about if other people don't wear face mask, what should we do? You just wear the best N95 to protect yourself. So don't bother. If they don't wear, leave them far away, and you wear yours.
I agree with you. Mask is the one to save our life. I think this is the kind of one in my mind. Wear your mask. Washing your hands all the time. Do you have a third question here?
Yes,
okay.
we do have a question about how do you envision the air travel between US and China?
Oh, good question. Danny, can you answer this question first?
Honestly, I haven't looked at the airline statistics. I think based on the news reports, with different countries closing their borders, obviously that's affected the airline industry quite significantly. I don't know the latest in terms of the China restrictions. I know that some friends who recently flew back to Taiwan, that you had to be a resident of Taiwan in order to get into the country, and they had the 14-day quarantine. So a family member just flew back and is still under the 14-day quarantine status at this point.
I see.
But yeah, I don't have recent stats on airline ridership.
Dr. Zhang, do you have your input?
Yeah, I think the United and Delta start to fly to China once a week. But the problem is that I don't see anybody would travel on business. I mean, this probably is transport this student going back to China or from China to here. And especially China is scared of the United States right now because we have so many cases. So they don't want to import any cases from the United States. So I don't see in the next 3 months, I don't see anything would improve. Air traffic would be slightly more, but I don't see much improvement.
I see. Now I look at the time. I don't want to answer anymore. Terry, can you give us one question from the list? So we have right now 115 people in the list, so we need to give them opportunity.
So I do have one. I think it's good for like a summarized question. So it's for all the three speakers. What time frame do you foresee US will be back to normal? Like the criteria he put was like say 90% reopen.
Dr. Zhang, you want to start first?
We're never going back to normal. That's my statement with COVID-19. This disease is going to be with us in the next 4 to 5 years. However, with the vaccination, if we have an effective vaccination, if we have a few effective vaccination, we can combine together. If the whole population get vaccination, then we will be safe. We can back to normal. However, in the United States and other countries, a lot of people are against the vaccination, and that could be also another issue. And so let's wait to see how successful the vaccination is. And we may go back to the normal in a year or two, but it's hard to 100% going back to normal.
I see. Danny?
Yeah, I agree with Dr. Zhang. I think going back to the normal that we thought we had before February or January, that's unlikely to happen. I think the changes and the impact of the COVID-19 is going to be with us for quite some time. But I think we all should be optimistic. Things will get better, when the vaccine does get developed and gets distributed. This is an opportunity that we can think about returning to a better normal for our future. So we can think about how we can create better environments, both built environment, work environment, social environments, for our future generations, where we can have cleaner cities, more active lifestyles, more cleaner environments for our future.
Yeah, my add-on to it is that we may have a new normal. the new normal is that we don't shake hands anymore. So we keep a certain distance, you know, professionally in the working place. I think shaking hands, the way the era for shaking hands will be gone. That's my thinking on this subject. Now I look at the time. We have a few minutes still left. I have one more minutes, but we may have a few minutes. We want to get the surprise out. So I want everybody to be ready right now to go to the third trivia question. This question will be also another $20 available. So far, I have 118 people on the list. I'm so impressed to see a lot of people still waiting for, maybe for the prize. I don't know. And this time, I would like to ask Terry to be ready, get set. Everybody ready? At this time, I want Terry to be ready to show the question. Do we have the first one?
We've got some answers. Oh, I think we got the first one.
Oh, good. So I'm so glad we got the first one. So I want the person to talk to Terry and also talk to.
No, sorry. The first one is not qualified. He is our board member. Sorry.
Oh, no way.
Oh, was it?
Ying Song, right? Yeah.
Yeah, that's right.
Now
we got
not eligible. Sorry
we got
for that.
Yao Xiao.
Yeah, Yao Xiao.
You got one? Good. The reason we want the third question down there is that, you know, CESASC is a very important organization. It is kind of the organization respected by so many Nobel Prize winners, right? You can see we have Li Zhengdao, Zhang, Yang Zhening, Ding Jiezhong, all of the people coming down to give us a speech before. So we can see we have a long tradition. I hope we continue our tradition to engage more qualified, Chinese Americans to be involved in our organization. Thank you for getting the first prize. I mean, the winner for this one. I hope you enjoy your $20, to do something with the one you want. So that's very important to you, to get your involvement in this organization. It's kind of my honor. It's kind of your honor to be involved.